Cobb County families sounding the alarm over the number of mothers dying during childbirth.
Nationwide, about 700 women die each year, but the risk is greater for Black women. Sadly, Doreen Plunkett is one of those moms, dying at just 41 years old. Her husband says a rare condition caused her death, and tonight he's talking to 11 Alive's Joe Ripley about what happened in hopes of saving another mother's life. Joe, how is this hurting family advocating for other moms right now?
Good evening to you, Sheba. The Plunketts sharing their story in hopes more folks get educated about childbirth, especially women of color who were more likely to die during pregnancy.
Over the last 18 months, Doreen Plunkett went to Washington, D.C. to care for COVID patients, and she learned that her family of 4 would soon become a family of 5.
She went into labor, so we rushed to the hospital. We told each other how much we loved each other. I left with a baby so I could take some good photos of the measuring and the weighing and all that stuff. Then after I left with a baby, all of a sudden, the whole situation changed dramatically.
Tony Plunkett remembers the rush of medical staff to the delivery room working to resuscitate his wife.
They lost her, tried to revive her, and then she started to bleed uncontrollably.
Just like that, Doreen was gone at 41, lost to an amniotic fluid embolism when fluid from the baby gets into the mother's bloodstream.
Most OBGYNs will go their whole career and never see one of these, but when they happen, it happens really quick.
Obgyn physician Dr. Sujatha Reddy says women with high blood pressure over 35 and who have had previous birth complications are at a higher risk. When it comes to moms dying during childbirth, Georgia reports the highest number of deaths in the country, with Black women 3 times as likely to die, according to the Department of Public Health.
African American women have a higher risk of certain pre-existing conditions, things like, cardiovascular disease, hypertension, being overweight's a risk for complications in pregnancies.
Now the Plunkett family is sounding the alarm, advocating for other mothers who face similar risks. They suggest talking with your doctor before heading into the delivery room.
No baby should leave the hospital without a mom. And that just breaks my heart to think about.
Connie called her sister-in-law a compassionate, caring nurse. Doreen's husband, Tony, called his wife a warrior, overcoming an early battle with a rare heart condition. Her last battle, he says, will give him strength to carry on.
I gave her such a lust for life because she knew how precious life was.
Doreen was originally from Zambia in Africa. She moved here in 2004 and found her calling as a nurse. There is an online fundraiser for the Plunkett family. You can find more information about how to donate at 11alive.com.